Over the last 24 hours, we identified 321 new cases of COVID-19 and completed about 6,425 tests. Our positivity rate was about 5.1%. There are currently active alerts or outbreaks in 201 schools. 10 of these schools have had 10 or more cases infectious in the school within the last 14 days. There are currently 518 people being treated for COVID-19 in hospital, including 101 in the ICU. Sadly, I must announce that 13 new deaths have been reported to Alberta Health in the last 24 hours. My deepest sympathies are with the family and friends of these individuals as they mourn the loss of a loved one, and to anyone grieving a loss, no matter the cause. Each death is a painful reminder about the seriousness of this virus and the need to keep protecting each other and our healthcare system from it. While over the past few weeks we have begun to come down the other side of the fourth wave, we have seen before how fast things can change. I would like to remind Albertans that we must stay vigilant, especially as temperatures drop and we head into winter. This is important for two reasons. First, during wintertime, more activities move indoors, where the risk of COVID-19 transmission increases. Second, it's now influenza season, which means we can expect a rise in the number of Albertans with respiratory symptoms and other illnesses, including seasonal influenza. Lastly, I would like to remind anyone who is eligible for third COVID-19 vaccine doses about the importance of waiting at least 6 months between your second shot and your third. While it may be tempting to get a booster as soon as possible, it's important to remember that vaccine protection is not just for now, but for the future as well, and we want that protection to last as long as possible. The available evidence shows that overall protection from the vaccine is best when a COVID booster is administered at least 6 months after the previous dose. By waiting the appropriate amount of time, you will receive greater protection from the vaccine. For those who are not currently eligible for third doses, please know that we are monitoring the evidence closely and will keep you informed if anything changes. So the risks of a fifth wave are similar to the risks that we've previously talked about. So we know that transmission increases when we have people who are infectious coming into contact with people who are susceptible to the virus, and the greater the number of contacts between people, especially in indoor locations, the greater the risk of transmission. We know we still have a percentage of our population who do not have the protection the vaccine offers. And while we know that there is some immune response after infection, it's not as strong as getting the vaccine. And again, if somebody has been infected, we strongly recommend that vaccination is added to that to give added layers of protection. So with still having people in the community who are susceptible to the virus, with the very aggressive nature and high transmission potential of the Delta variant, and with the seasonality of the virus, people moving inside and having that increased risk in indoor settings, there is a risk that we could see a fifth wave. And again, as always, we have the tools to be able to minimize the impact that has, which are the things I just talked about, making sure that we're doing those regular everyday things, staying home when sick, washing hands regularly, being vaccinated against influenza and COVID-19. And those are the things that the more of us that participate in that multi-layers of protection, the less the chance of a fifth wave that could increase the strain on our healthcare system this winter. So I think what I talked about is the risk that there could be a potential future increase in transmission and the things that we could collectively do to mitigate that risk. Over the last week or so, we've seen in terms of our new cases and our positivity rates that we're in a bit of a plateau, but we are still slowly declining, just not as fast as before. So I think decisions about the kinds of frameworks and measures that we need to have not yet been made. And of course, whatever those frameworks and measures are that are in place, it's important not just to follow those, but also to keep in mind all of the things that I just mentioned, because we know that the more people who are vaccinated, the more people who are taking those basic measures to protect themselves and others, the more we mitigate the risks of increasing transmission over the next several months.